Today, we're diving into a topic that affects almost 1 in 5 Canadians: irritable bowel syndrome, or IBS. With Canada having one of the highest rates of IBS worldwide, it's a condition that deserves our attention. I'm joined by Dr. Christine Palmay, a renowned family doctor from Midtown Toronto, who is here on behalf of caretoknow to help us understand IBS. Welcome back, Dr. Palmay.
Thanks again, Candace. Happy to be here.
Can you start by explaining what irritable bowel syndrome is?
So, we don't fully understand. What we know is that there's an imbalance in the gut-brain axis, meaning the biofeedback from your gut, something's happened. And there's a couple of supposed theories. We think it could be hormonal, stress. There could be an imbalance in the gut biome. I know probiotics. I speak ad nauseum about probiotics to my patients. Dietary factors, but really, it is a syndrome, and that's what I most emphasize to my patients. So some patients will experience constipation, some patients will experience diarrhea, and sometimes the specific treatments differ at the tail end of a diagnosis. But really, holistically, it's about understanding a patient's personal journey. The reality is IBS affects quality of life. People are upset, they're miserable, they're in pain, they feel out of control, they feel unwell, they don't want to go out, they don't want to socialize. There's body image problems, fear of food that may trigger, not wanting to travel. The list goes on and on. So you can see how this syndrome also affects mental health, physical health. It really, really is complex.
And what are some of the common symptoms then of IBS, and how can individuals distinguish these symptoms from maybe other digestive conditions?
Quite hard. Usually it's by process of elimination, right? We rule out any other sinister things. So making sure your thyroid's functioning, in some cases having a colonoscopy and abdominal ultrasound, because there's other mimickers. But usually at the end of the day, testing, thankfully comes back normal, but unthankfully doesn't lead to a diagnosis. And with IBS, the constipation subtype, people are more constipated, oftentimes going days without bowel movements, feeling bloated, gassy. There's a diarrhea subtype as well, that is quite the opposite, triggered by food and stress. And I think that, part of the frustration from a patient is there's not one set of symptoms. Everybody's so different, which also makes it equally as frustrating for healthcare providers. So documenting your symptoms, being aware, understanding regular bowel movements, having those in-depth discussions with your healthcare providers that are sometimes uncomfortable are absolutely necessary.
And 80% of 80% of IBS patients are women. That's astounding to me. So why is this so prevalent in women?
So number one, women access doctors a bit more readily. So I think that's probably a little overreported. However, there's a hormonal component too, which is, different for females. Lifestyle, there's mental health changes. I think truly I wouldn't say it's overreported in females. It is underreported in males. I don't think males show up at the doctors as readily as they should. Hopefully that will change. But we do think there is a hormonal component.
And there's obviously psychological aspects of this as well. It's not a pleasant condition. So what strategies can individuals employ to cope with the stress and anxiety that accompanies it?
So looking at diet, right? What are your triggers? In some cases, food sensitivities can be analyzed, and while they're not necessarily validated 100%, I have several patients that know what they can eat, what they can't. Keeping up hydration is really important. Making sure that you're having a balanced diet. It sounds so basic, but going back to what your mama and papa said, I encourage probiotics, making sure that your gut biome is healthy. That's another topic for another day, but it's fascinating. Exercise is so important. Not just for mental health or cardiovascular health, it actually stimulates anti-inflammatory processes. It actually moves food through the gut. That can be really helpful. Managing stress too, meditation, breathing. I certainly know that when I'm under stress, my gut goes wild. And I've identified that. And oftentimes I don't know I'm stressed until my gut goes wild and sort of I think, oh, I forgot that self-care cue. And then, of course, accessing your primary care provider. We have excellent medications available, particularly in the realm of IBS-C, so the constipation subtype. There's some really big game changers that have since emerged.
All right. And if people want to know more about IBS and how to manage it, we're going to avoid Dr. Google. And where's the best place to go?
Well, you can use Google. Just put in caretoknow.ca, credible site. I am so excited about the expanding viewership of this site. It's medically approved. We have experts like myself that are providing input. It's evolving, topics are changing, and the information is being updated according to updated guidelines. I know everybody's saying everything's changing every moment, but medicine is science and science evolves. So caretoknow.ca, it's free. Sign up, you get healthcare information emailed to you, and the site is full of many, many different topics that are pertinent to our listeners.
Yeah, with so much misinformation swirling around, it's important to go to credible sites. And you, of course, as usual, you've gone a little deeper into the subject for us, and people can find that on whatshesaidtalk.com. And you will be back next month because we're going to be discussing rosacea.
See you soon.